And in this video, as the trial of the nurse Lucy Letby nears its conclusion, the jury now hear from the judge and his final summing up of the case against Lucy Letby. The judge moves on to the case of Child H. Child H was born in good condition on September 22, 2015 at the Countess of Chester Hospital, weighing 5 pounds and 2 ounces. Child H was very unstable into September 24th, suffering desaturations, bradycardia and pneumothoraces. Dr. Evans and Dr. Sandy Bowen agreed Child H should have had surfactant earlier, and the judge says it is accepted that care was suboptimal. There was also an unacceptable delay in intubation. They said although the pneumothoraces were a complication, and some of the suboptimal care may have led to later pneumothoraces, none led to the later collapses of Child H, for which neither could find a cause. Child H was later transferred to Arrow Park Hospital where she improved and had no further cardiac arrests. She returned to the Countess of Chester Hospital on September 30th. Letby denied harming Child H. She raised the issue of suboptimal care, issues with the chest drains, and said there was a cumulative effect for Child H which led to her collapses. The defence say an innocent explanation for the collapses cannot be ruled out. The judge details the events for Child H prior to September 26-27th, which involved 2 chest drains being put in place in response to desaturations Child H had. The tip of the second chest drain moved around. In cross-examination, Dr. Ravi Jairam said the second chest drain tip would not come into contact with the heart, and it was very unlikely it would come into contact with the sac around the heart. He had not heard of any event where that had happened. Letby had messaged colleague Sophie Ellis on September 25th saying it was, quote, pretty bad so far how busy the unit was. In evidence, she said she had come across chest drains in Liverpool where the drains were stitched in, but not in Chester, and no one seemed familiar. A third chest drain had to be obtained from a children's ward. Dr. Alison Venture said the second chest drain on September 25th-26th had almost fallen out, and Child H's oxygen requirements gradually increased. Dr. John Gibbs said unusually Child H had developed another tension pneumothorax. The 2 chest drains were blocked with serous fluid and the third chest drain was inserted. Both Dr. Gibbs and Dr. Jairam said drains can become blocked. There was then a marked improvement, the judge tells the court, for Child H. At 3:22 a.m. on September 26th, Child H collapsed and full resuscitation began. Child H quickly improved and resuscitation was stopped. The cardiac arrest had no obvious pneumothorax and there was no evidence of fluid around the heart. Child H's temperature was normal. Dr. Gibbs concluded the event was caused by hypoxia, lack of oxygen, but the explanation for that was not clear. Child H had chest drains and was deemed unstable for transport, so remained at the Countess of Chester Hospital on September 26th-27th when she collapsed at 12:55 a.m. Dr. Matthew Neame said his recollection was when Child H collapsed, Letby was neopuffing her. He assumed that she was Child H's designated nurse. It was, however, Shelley Tomlins who was the designated nurse for Child H that night. He noted thick secretions blocking the ET tube. Shelley Tomlins had noted Child H had a profound desaturation to 40%, despite equal bilateral entry and positive capnography. Letby in cross-examination was referred to text messages of her involvement with Child H that night. She said she had been assisting. Child H had another collapse at 3:30 a.m. and Dr. Neame responded. He believed Letby was present. Child H was reintubated and her oxygen level and heart rate remained low. Dr. Saladi had been called to assist with the resuscitation and contacted a consultant at Arrow Park as there was no explanation for the collapse. A blood test revealed a raised result for an infection marker, CRP levels, and Child H was transferred to Arrow Park. Letby in police interviews recalled caring for Child H as she had chest drains. She did not recall where she was when the first profound desaturation took place. She thought the cause could have been some form of airway problem. She was unable to explain the collapse and denied deliberate harm. She agreed she had searched for Child H's mother on Facebook, but did not know why. Letby, in evidence, denied she was bored on her shift and said the timing of her text messages could have meant she was on a break. She denied having interfered with Child H's tubes on any occasion. Dr. Evans said a deterioration of Child H would have been much more gradual if she had had an infection. He said a pneumothorax was a complication of Child H's clinical condition. He said the overall picture for Child H was that she improved significantly and quickly when responding to treatment. Dr. Bowen noted the presence of respiratory distress syndrome and that had surfactants been given earlier, that would have reduced but not removed the likelihood of a pneumothorax developing. There was an unacceptable delay in the first intubation and the needle may have punctured lung tissue. The collapses on September 26th and 27th mirrored each other in having no obvious cause and were not quickly resolved, Dr. Bowen had said. She could not identify any cause for these significant collapses. Professor Owen Arthurs said the radiograph images showed a recurrent pneumothorax. He said there was no ideal position for a chest drain. He said there was movement of the second chest drain. He said they are not generally known to cause bradycardias, particularly in neonates. The judge refers to the case of child I, born on August 7, 2015 in Liverpool Women's Hospital before being transferred to the Countess of Chester Hospital on August 18th, where she was expected to improve with no ongoing concerns. Child I died on October 23rd. The prosecution case is on 4 occasions Child I suffered sudden and unexplained episodes as a consequence of deliberate harm by Letby. They say the final event caused her death and Letby is responsible for murder. Letby says she did not harm Child I on any occasion, and whatever the causes of her deteriorations, she was not responsible. She said there were periods when Child I desaturated and was being treated for infection, suspected infection, and suspected NEC. The prosecution say for 3 of the 4 events, Child I rapidly recovered, and the other desaturations and infections are explicable. The judge refers to an event in late August 2015 when Letby was not on duty. Child I had a distended abdomen and an NG tube dislodged. Dr. Bowen, in cross-examination, said this decline differed from later events. Child I had slowly deteriorated due to signs of infection and needed the use of a ventilator. Child I was returned to Liverpool Women's Hospital with suspected NEC. While there, she had a profound bradycardia, with her airway found to have large secretions in the ET tube. Child I recovered from the episode. The judge refers to the first of the 4 events on September 30th, when nursing staff were very happy with Child I at this point. Lisa Walker carried out a skin patch test on Child I that day, which she would not have done if Child I was not well. On September 30th, Letby was a designated nurse for Child I and 2 other babies in room 3. Letby said in evidence she did not do anything to cause the event for Child I. Dr. David Harkness said in agreed evidence, other than being pale and a slightly enlarged abdomen, there was nothing to worry about. The judge refers to the target weight gain for babies. Child I was at the lowest percentile end. Dr. Newby said Child I's weight was low and dropped down the percentile guidelines, but there had been numerous events in life when they had been unable to feed Child I due to abdominal distension. Dr. Bowen said it was no surprise Child I's weight was low, and Child I was unable to be fed as she had been ill. The judge says Letby had noted of Child I's abdomen, quote, "Mum feels it is more distended to yesterday and that Child I is quiet." In evidence, she said Child I waking for feeds was regarding the 10 a.m. feed. At an addendum, Child I was, quote, "reviewed by doctors at 1500 as she was mottled and monitoring was recommenced." There was no corresponding doctor's note. In evidence, Letby said she believed it had been a male doctor and it was the same name given when she was interviewed by police. She denied force feeding and causing a vomit for Child I. The mother of child I had by the time of the desaturation left the unit and the father was at work. Child I desaturated and had a large vomit at 4:30 p.m. after a feed recorded by Letby of quote 35 ml via NGT at 4 p.m. A doctor had made a note for Child I's event where Child I dropped to 30% saturation, but by the time he arrived Child I was breathing well, was pink and the chest signs were clear. The abdomen was a little distended. Bernadette Butterworth recalled Child I's heart rate dropping and she desaturated. She required Neopuff. She saw Child I's stomach distending and milk and quote air aspirated. Letby said she did not know why so much air was aspirated. She said in evidence she had not pumped Child I full of air. Dr. Harkness saw Child I that night and Child I was breathing well for herself and a blood test showed no obvious signs of infection. However, she did not like being handled. Nurse Ashley Hudson noted Child I was stable on October 1st. By October 12th, Child I's feeds and weight were up, with feeds given every 4 hours of about 55 ml of milk. At 1:30 a.m. on October 13th, she took a 55 ml bottle feed. For the second event, the judge says Ashley Hudson noted Lucy Letby saying Child I looked quite pale. When the light was turned on, Child I looked very pale and the monitor was not sounding. Neopuffing was established, heart rate in 50s. Letby wrote her note later, and the judge says she would have been able to see Nurse Hudson's note at the time of writing. Letby quote, Child I noted to be pale in cot by myself. Senior Nurse Hudson present. Apnea alarm in situ and had not sounded. Minimal shallow breaths followed by gasping observed. Child I was given a blood transfusion. An X-ray showed quote marked gaseous distension of bowel loops. A blood test showed no bacterial growth after 5 days. Ashley Hudson confirmed she had given Child I a feed at 1:30 a.m. and Child I seemed very stable and her waking for feeds was really encouraging. She had assisted Laura Eagles with a procedure for about 15 minutes. She would not have left Child I alone if she was unstable and would have asked a colleague to keep an eye on the baby. The other colleague on duty, Caroline Oakley, has no memory of being asked to do this. In evidence, Nurse Hudson said Letby was standing in the doorway, standing 5 to 6 feet away from the cot. The lights were switched off and the corridor light provided some illumination. There was a canopy over the upper part of the cot and blankets were on Child I. She switched the main light on and was closer to Child I than the defendant. She could see Child I was pale. She pushed back the canopy and blankets to tend to Child I. The apnea alarm had not sounded and the deterioration was very surprising. Letby, when interviewed, remembered the event. She said when she and Nurse Hudson went into the nursery room, they put the lights on and saw Child I was pale. She denied injecting air into Child I's stomach. She thought they were at the doorway and had just put on the lights and the nursery was, quote, never that dark that you would not be able to see the baby. In second interview, she said, quote, maybe I spotted something that Ashley wasn't able to. She said from her position she noted Child I was pale. In her evidence, she was asked how she could spot something that Ashley Hudson couldn't, to which she replied, I knew what I was looking for. I knew what I was looking at, which she corrected herself. In evidence, she said she could not recall looking after Child I prior to this event. She recalled herself and Nurse Hudson going into room 2 together and could see Child I's face and hands. Child I was gasping and shallow breathing, so the alarms didn't go off. She remembered telling Nurse Hudson she looked a little pale. She said room 2's lights were on a dimmer switch and it was not as dark as a photo identified by Ashley Hudson in evidence. Dr. Elizabeth Newby said she was called to the room and as she arrived she passed Letby in the corridor. Resuscitation took place on Child I and it took 12 minutes before signs of life were detected. She said it was, quote, definitely a serious state of affairs. The ETT was seen by Dr. Matthew Neame to be too far in and the NGT was also not in the right position. By the following day, Child I was seen by Dr. Harkness and assessed to be, quote, sick but stable. The judge refers to the third event for child I on October 13th to 14th. Child I was in room 1. Dr. Neem reviewed child I, who was, quote, settled and pink with breathing a bit squeaky, normal in ventilated babies. The abdomen distended but soft. Letby noted for child I on October 14th, quote, at 0500 hours, abdomen noted to be more distended and firmer in appearance, with area of discoloration spreading on the right hand side. Veins more prominent. The judge says there are no corresponding medical notes for this. Child I, quote, grimaced on Dr. Neem palpitating the abdomen, which was noted to be mottled and distended. His impression was that the increasing abdomen distension caused the lungs to be squashed. The increased tenderness and skin discoloration stood out to him. He consulted Dr. J-Ram, who was told of the distension, and it was decided to continue with the ventilator settings. After Dr. J-Ram consulted Alderhay Children's Hospital, they said they would contact the Countess of Chester Hospital with a plan in the morning. Child I had a cardiac arrest at 7 a.m. Shelley Tomlins noted child I was pale and veiny, with slightly greyish discoloration. Dr. Neem thought the swollen abdomen was squashing the lungs. By the time Dr. J-Ram arrived, child I was stable. An X-ray showed no evidence of a pneumothorax. Letby, in evidence, said she did not have any recollection of the shift other than from the notes. She agreed the signs were initially good for child I. She said she had not inflated child I with air or sabotaged her. Child I responded very quickly to treatment and stabilised after being transferred to Arrow Park on October 15th. She returned to the Countess of Chester Hospital on October 17th. The trial judge is now referring to the fourth and fatal event. Child I was pronounced dead on October 23rd at 2:30 a.m. Child I was not an intensive care baby, but was in room 1 as a precaution, the court is told. Designated nurse Ashley Hudson had agreed child I was settled and stable the night of October 21st, 22nd. The following day, child I remained nil by mouth and was unsettled at times, as recorded by Caroline Oakley, but settled with a dummy. Her cares were attended to by child I's mother. For the night of October 22nd, 23rd, Ashley Hudson was again a designated nurse for child I. Letby said she did not recall in evidence much of the night shift when child I died. She said staffing levels might have played a part. The judge says just before midnight, Ashley Hudson said child I became unsettled and had very loud crying, relentless crying, something she had not heard before from her. Child I was put on her tummy and she became quiet, and there were gaps in the breathing. Child I was turned over again and Nurse Hudson called for help. Letby said in evidence she had not heard that crying. She said she became quiet and apneic. Dr. Rachel Chang and Dr. Gibbs were called and CPR began on child I. She was ventilated and recovered. She was pale and mottled blue in her trunk. The colour steadily improved over 5 minutes and child I became pink all over. It was decided to extubate child I as she was fighting the ventilator, which is a good sign. Dr. Gibbs was unsure what had caused child I's rapid deterioration. He said he could not understand what natural disease could have caused it. A large stomach bubble was seen in an X-ray for child I. Letby, in cross-examination, was asked about a record for one of her designated babies that night, the Stoke baby. The baby was noted by Dr. Chang to be safe for transfer. Letby had noted between 10:50 to 10:52 p.m. to commence 10% glucose for transfer. The IV fluid chart showed the start time altered from 11 p.m. to midnight. In response to the allegation of falsifying records, Letby said the 11 p.m. was an error which she had corrected. Nurse Hudson said child I was behaving normally prior to the final desaturation. She did not recall how she was alerted. She said when she arrived at child I, Letby was already there at the incubator. Her hands were inside the incubator with a dummy trying to settle child I. Child I's crying was loud and relentless, and Nurse Hudson was concerned child I was going to collapse again. The nurse recalled she said something along the lines of, "She's going to do it again, isn't she?" And that Letby replied, "She just needs to settle. She just needs to settle." Child I then collapsed. Dr. Chang arrived at 1:12 a.m. and was joined by Dr. Gibbs in trying to resuscitate Child I, who had mottling of purple and white all over. Efforts to resuscitate were unsuccessful. Melanie Taylor said they were all devastated and it was pure shock, and this was the second death she had been directly involved in. She was never concerned about the treatment or care that babies received. Ashley Hudson was supported by Letby. The mother of Child I recalled Letby was smiling and kept going on about how she was present at Child I's first bath and how much Child I had loved it. Letby had said she was trying in that awful situation to create a positive memory for the parents. Letby was asked about a sympathy card she had taken a photo of for Child I's family on the day of Child I's funeral. She searched for the mother on Facebook on October 2015 and May 2016. Letby said she did not remember if she was present when Child I collapsed, and maybe she had gone to her after hearing her crying. She said the transfer process would have been stressful for Child I and believed the process was done too quickly. She said it was upsetting losing Child I, and she regularly took pictures of cards she sent. She did not know why she had searched for Child I's mother on Facebook. She recalled settling Child I after crying, but did not know if this was after the first or second collapse. Professor Arthurs reviewed all the radiographic material. He said lungs were normal prior to the final collapse, and it was quite unusual to see massive dilation of the stomach, which could cause splinting of the diaphragm. The post-mortem imaging showed dilation of the bowel, and he said that was present before she died. He said there are not many conditions which cause dilation of the bowel. He said one of the explanations was air deliberately administered down the NG tube, and that was his inference. Dr. Kokai carried out a post-mortem examination of Child I. Dr. Andreas Marnarides was dependent on the report. Dr. Marnarides said Child I did not have NEC. He was very sceptical that Child I died of natural causes. He said the collapses were more likely to be excessive air administered to the stomach via the NGT. The defence say a similar event happened for Child I on August 23rd, a day when Letby was not on duty. Dr. Evans said Child I's weight gain could have been better and attributed that to her illnesses. He formed the view Child I had received a large volume of air down the NGT. He said it would have to have been sizable to cause splinting of the diaphragm. He refuted suggestions he had taken events from September to support a prosecution case, saying at the time of his report no one had been arrested. Dr. Bowen said she too thought abdominal distension had splinted the diaphragm in the first event. She discounted NEC. Dr. Evans said the second event was more serious. He refuted suggestions he had been looking for evidence to support the prosecution case. Dr. Bowen said she was not sure if an NGT was in place at the time. There was no clinical need for one, but it was practice to keep one in place just in case. She accepted in her report that she said Child I did not have an NGT. She considered air in the vein was a possibility due to the subsequent discoloration findings. Dr. Bowen was accused of backing up Dr. Evans. She refuted that, saying she was independent and had disagreed with Dr. Evans on some conclusions. She said she had seen air embolus twice in babies in her career and explained what the symptoms were, saying the clinical presentation was wide and varied. She agreed there was nothing specific about discoloration that made it diagnostic of air embolus, but it was, however, consistent with air embolus. Dr. Evans said for the third event, he came to the conclusion of a large volume of air administered via an NGT into the stomach. The response to Child I's resuscitation was not what he would expect. In cross-examination, Dr. Evans said this was a separate event, not a continuation of an existing one. Dr. Bowen concluded it was an air embolus caused by excessive air administration. For the fourth event, Dr. Evans said Child I was a stable baby prior to the collapse. He said he thought air was administered on this occasion via the blood. He thought the relentless crying as described was of a baby in pain and distress, and there was no explanation for this. In cross-examination, he denied he was going for whatever mechanism that could support his explanation. He said if air was injected in the stomach as well, that was something he could not rule out.